Welcome. All right, I'm seeing the numbers stabilize here, so I'm going to go ahead and get us started. Welcome everyone. I know me well, Adrianne, Finley, Odell, head of school at Roycemore School, and I'm really pleased tonight to have the opportunity to talk with all of you about what's happening with COVID in our community and at Roycemore, and to introduce you to Dr. Lakshmi Halasiyamani, who is the Chief Medical Officer at Northshore University Health Systems. Thank you, Lakshmi, for joining us tonight. Really
happy to be here, of course.
Lakshmi has joined our Health and Safety Task Force this year to help us navigate all of the information that's been coming our way regarding COVID-19. And we're really fortunate to have her expertise. She is the Chief Medical Officer at Northshore University Health Systems. And prior to that, she served as their Chief Quality and Transformation Officer since October of 2016. And this year, that role included overseeing all of the COVID-19 health and safety since the start of the pandemic. So you can imagine what her life is like in that role. And because of the protocols they put in place there at North Shore, they had 50% fewer COVID cases than the surrounding community. So really tribute to great protocols there. And Lakshmi received her bachelor's degree from St. Louis University in chemistry. And I love this, English literature. Go liberal arts.
Yeah.
And she received her MD from Harvard Medical School. So we're really fortunate to have her here tonight. And I'm going to share my screen. And let's see. No, I'm not going to share the whiteboard. Let's see. Yeah. There we go. And yes, thanks to Lakshmi for joining us. I'm going to let her share with you a little bit about some of her observations of what's going on and a great new service that North Shore has offered. So Lakshmi, I'm going to let you talk about this and what you're seeing at North Shore right now.
Great. Thanks a lot, Adrianne. And I guess what I would just want to make sure is that everyone feels very comfortable, kind of putting questions in the chat. I can appreciate that, we're still all learning about COVID, but we've learned a lot since what we knew initially in March. And, just to give you a little bit of an overview, when all of this began in late January, early February, we knew very little about what would keep us safe and the transmissibility of the virus. And, I think we've come a long way. And when we think about our ability to now diagnose COVID, primarily we're using the PCR test, which is a nasopharyngeal or an oropharyngeal swab. But we're growing in our abilities to soon be able to implement tests that are surveillance tests. So when you think about other viruses that we have in our communities, the way we know whether someone is at risk for them is that we have public health that does surveillance testing. So when we look around the community right now through we call them virograms, what we see is that there's only COVID. So if someone has a fever and myalgias, they don't have the flu right now. They have COVID. And so that kind of surveillance is incredibly helpful for us. But what's important to understand is that the test that was approved to diagnose COVID was never approved as a surveillance test. So the reason I'm spending a little bit of time talking about this is because I'm sure many people want to use testing as a way to kind of guarantee safety. And the challenge with that is the PCR diagnostic COVID test can remain positive for months after someone has recovered. So it's very hard to know what to do with that result in the context of a environment like a school or like some other gathering place. So I think it's important to ask, well, what does keep us safe? Well, actually, what works are the safety practices. And so we've learned, and I'm grateful that I think have a little bit more of a evidence-based CDC now, and I think we're going to get better guidance from them as early as yesterday, where they shared that mask wearing isn't just beneficial for others, it's beneficial for the person who wears the masks. So what we found in our environments, and remember, we're a healthcare setting, which means we have to take care of sick people, and we take care of lots of people who had COVID. In fact, our numbers are now back up to about 110 patients hospitalized. And just to give you some perspective on that, 2 weeks ago, that was 30 patients. So you can see how quickly our inpatient volumes have grown based on the increases that we're seeing in the community. But what we've learned is that when our team members wear masks and eye protection, they don't get COVID. And in the environments where people are taking care of patients with active COVID infections, when they wear the right PPE, they don't get COVID either. So what's critically important is that the masking makes a huge difference, as well as some of the source controls, which are the symptom screening and the social distancing. So again, incredibly important, because we didn't know that when we started all of this in March. We all sort of stepped into this space believing that it would be safe. And I can tell you now, 8-9 months into this, we've had a very positive experience in anchoring off of these safe practices. Unfortunately, we are not anchoring off of them as a society. And that's actually why we're seeing the numbers where they are today. So again, to give you a little bit of context, in April and May, Illinois would have daily numbers of 3,000, 4,000, 5,000 cases. And now Illinois has daily numbers of 11,000, 12,000 cases. So when you look at that in the national context and you see on the news that the US has 100 or 120,000 cases, 10% of those cases are in Illinois. And again, when you look at the state of Illinois, the positivity is no longer isolated to the urban areas. Everyone who lived in small towns used to think, gosh, good for me, I don't have to worry about COVID. Well, that's changed. And the entire state of Illinois is blue, which means that there are COVID cases everywhere. So again, what we're finding when we look at the epidemiology of what's driving these large case counts is that the people testing positive has shifted to a younger population. So the most common group are those aged 18 to 30, 35. And we're seeing that even in our employees. And when we look at our employees who are testing positive, they're not getting COVID from coming to work. They're getting COVID from going to a restaurant, going to a bar, or having a gathering with people they think look like they shouldn't have COVID. So that's the other challenge here, is that we're letting our guard down and we think, you know what, you don't look like you have COVID, so let's get together. And then the second thing that I don't think is insignificant is, in March and April, people were scared, and so they stayed home. And now almost everyone has a friend who's had COVID, and many of them have done just fine. So there is this underlying narrative of, is it really such a big deal? Because, my buddy got COVID and, he was just out for a couple of days. He didn't feel well, but wasn't so bad. So there is an evolution of our, unfortunately, fear does work, and we don't have that anymore. And so that's also contributing, I think, to the spread. And so currently we have very broad community spread. And that's why we're seeing the positivity at the rates we have, and the overall positivity rates have gone up significantly. We measure the positivity rates in the testing that we do every day. And, we separate out individuals who have symptoms versus those who are tested for other reasons prior to a procedure, or they're delivering a baby, but they are not really symptomatic. In the symptom group, our positivity rate now is over 30%. And in July, that number was about 7%. So again, you can see the shift that's happened, over the last several months. And I think those are some of the key drivers of that shift.
Thank you. Do you want to talk at all about the safety promise?
Yes, absolutely. So again, I'm sharing this with all of you, and I'd love for you to participate. And I actually think as we talk through the questions this evening, you're going to hear me continue to say the same thing about the safety practices. So what we're asking is for individuals to go, take a picture of this QR code, and that'll take you to our webpage, and for you to take the safety promise. So the safety promise outlines specific behaviors that you commit to, that you will wash your hands, you will wear a mask, you won't attend large gatherings, you will be mindful of your symptoms, and you will speak up about your mental health, because this is a very stressful time, and we want folks to feel that we're in this together. And our belief is that if we all commit to this promise together, that we are going to have a different outcome. So we've created the safety promise as well as a set of a safety toolkit. So many of you, and probably your kids perhaps, are on social media. So there are ways for you to download some of these things where you can put your face, send it out on your Instagram account or your Facebook account. And that way you can begin to spread the message. And our tagline is, spread the message, not the virus. So again, the real goal here is for us to anchor what we have today, which is the safety practices. So I would love it if all of you would go and take the safety promise. Maybe the whole school could do it. And that might be a great way to continue to engage people on the good of kids being able to come to school. I think people want a free lunch. They want their kids to go to school, but then be able to do everything they want to do. We have to prioritize that going to school is actually the most important thing probably right now. And when you look at other countries, they have prioritized it. And we're the only country that wants to close down a school before we close down a bar. What does that say about us? So, obviously I have a point of view, but I think it's incredibly important. And that's why I'm participating tonight. I think it's incredibly important for us to do whatever we can to help kids go to school, because it's an incredibly important part of their development and their own well-being. And so, as we go forward, we have to define what the supreme good is in whatever choices we make. And that might mean that you don't get to have Thanksgiving with 20 people. That might mean that you have to stay within your family and Zoom everyone in for your Thanksgiving. But if you want to be able to have kids gather in schools, we have to make other sacrifices to make that happen. Yeah. So please take the safety promise and share the toolkit.
Yeah, thank you. I love the toolkit and the safety promise. And the promise aligns beautifully with the community pledge that all of our families signed in the return to school agreement. So the one addition on North Shore's promise is the mental health piece. And, I really want to highlight that because, and I'll share some data from a webinar I was on yesterday, but there's great concern about mental health during COVID because of the isolation, and particularly with students who are having to go to school remotely. And, we want to do everything we can to try to prioritize on-campus learning while also balancing the health and safety of our students and our faculty. And, we'll talk some more about that as we go. Let's see here. Next slide. So as I mentioned, I participated in a webinar yesterday put on by the National Association of Independent Schools. They do a weekly trend report, and the presenter was Dr. Marlene Miller, who's the pediatrician in chief and chair of pediatrics at University Hospital's Rainbow Babies. And so the next few slides are from her presentation. And, here she's just re-emphasizing some of the things that we were already talking about. But one of the things that I wanted to highlight here was particularly to ensure families continue those well care and preventative care visits, because what they're finding is when students are or children are going to the hospital, they're not seeing them for more mild things like sports injuries, for example, right now, because there's not as much sports happening, but for really severe issues, chronic health issues, or pretty severe COVID issues. She also shared this slide, which I thought was a really terrific one in terms of boxing in COVID to get all of us working again. So, the testing, making sure you are isolating. So, if someone does test positive for COVID, it's so critical to isolate so that you're not spreading, and work with the contact tracers with the Department of Health to make sure that people are notified, and then that quarantine piece. This slide, I know I took pictures of her screen, so some of my slides are a little bit skew with, but this one I thought was helpful just to give a sense of some of the various approaches to vaccines that are going on out there. And for those who really geek out on this stuff, you can go on to this New York Times coronavirus vaccine tracker. And this is also from that tracker, which shows the different phase trials that different vaccines are in, that there are 38 different ones being in phase 1 trials, and phase 2, another 14, and then phase 3, 11. But only 6 globally are vaccines approved for earlier limited use, and there are no vaccines approved for full use on a global scale yet. So there's still a lot of work to be done. And what's important to know, and I hadn't clued into this until yesterday, none of the trials have been on children yet. These are all on adults. So, even when they become available for the general public, it's going to be a while before they're going to be accessible to children. And this is showing the kind of phased approach of how vaccines will be released bit by bit. And, right now we're still back here in this phase 1. And we're actually not even there in terms of really the limited doses really being available. They're still in the trial, but when they come out of that, the phase 1 will take a while, and then it will be expanded to greater populations. And I don't know, Lakshmi, if you have anything more from your knowledge and what you're hearing to share about this.
Yeah, I mean, you all probably heard the good news from the Pfizer trial. So the Pfizer vaccine is one of the mRNA vaccines. And what's interesting is that when they look at and establish kind of the parameters for the trial, they have to establish what they believe the efficacy will be of the vaccine. So the study was powered believing that the vaccine would only be 60% effective. But what they found was that it was actually 90% effective. So they actually got their results earlier than they thought they would. They are going to complete the rest of the time frame for the remainder of the enrollees. But this is very positive information to the point where we've already been notified through IDPH that we are likely to have vaccine to distribute in this phase 1, perhaps as early as December. So again, there's a lot of, unfortunately, it gets mired in a lot of politics in terms of how many doses different entities will get. Is the entity the town? Is the entity the hospital? Unclear. But But the first phase of vaccines is really for healthcare workers and essential workers, and those in congregate living settings, primarily nursing homes, et cetera. But that's very, very good news.
That's terrific news.
Yeah.
Keep it coming.
Yeah.
Yeah. This next slide is, and this is data from Ohio, because this is the pediatrician from University Hospitals in Cleveland area. But what she shared with us was this data they found to be pretty similar nationwide. And again, maybe Lakshmi, you can concur if it makes sense on your end. But you can pretty much see this trend line just kind of going, from left to right upwards, from a younger age to an older age. So, age 1 up to age 17 in terms of the positive rates by age. And they said, what they're seeing, the older kids are, the more social they are, the more interacting they are. And so then you're seeing the higher rates of COVID.
Yeah, I would say that is correct. And when you look at the data that you shared over the weekend, Adrianne, about, what we're seeing, again, the places that people are getting sick aren't by wearing masks and coming to school, right? You're not going to get COVID from other masked people. It's when you say, I'm going to go have a sleepover because, you guys don't have COVID, so I'm going to hang out with you. And then we let our guard down and then we come to school. So I think that's really the key message here. And then when you look in that younger group, I'm sure they probably have tighter bubbles that they're within. And so that's why you see a lower rates.
Yeah, thank you.
Mm-hmm.
This slide reinforces what I was saying before about the concern regarding mental health, that, they're seeing visits to mental health care providers and hospital admissions for mental health increasing during the pandemic, whereas kind of, the more, mild, needs in decreasing. So being aware of this and getting kids back in school is, really important for a lot of reasons. And then, looking ahead, we are seeing now these just extraordinarily high COVID rates and cases, and, hospitals reaching capacity with ICUs. And I know, Lakshmi, you could probably talk about that. Anita Shah, who I know is on this webinar tonight also, was saying how they're just full and not, back to where we were in the spring, and nurses exhausted and, concerned about, having enough people to staff the hospitals. I think that's a huge issue for us. And I don't know what you're seeing there at Northshore.
Yeah, we're seeing the same thing. And the difference now versus the spring is that in the spring, everyone stayed home. And, that had its own negative consequences because people did have their heart attacks at home. They did have, negative health consequences by not coming because everybody was too scared to come to the emergency department. But people aren't scared anymore, and they've figured out that we know how to take care of them. So our ED volumes are incredibly high right now. And so if that persists and the COVID comes, we're going to run out of beds, and we're going to run out of people because, at the end of the day, our teams are filled with people. They have families, they have their own concerns, which are all very valid. So this is going to be very difficult, and we have to think about, again, what are the alternative care environments that we can take care of people that aren't the hospital, because the hospital is going to be under a lot of strain.
Well, it's a little frightening, isn't it?
Yeah, well.
This picture I am sharing with you because some of you may have seen the news releases that came out that indicated that schools are the highest exposure location for COVID right now. And technically, if you look at this, that does tell you that picture. But as Lakshmi was sharing previously, there's a little bit more to the story. And the next couple of slides do share that. That while they're saying schools, the traces of it are because of out of school context. So the sports, the sleepovers, the parties, this shows that too. And that's the concern. You know, we're going to do the right thing here at school. We're going to make sure the kids are wearing masks. We're going to make sure they're washing their hands. We've got, you know, working on the social distancing all the time, although I will say for some students that's hard and we've got to stick with it. But we need all of our families to make sure what happens outside of school is as stringent as what happens inside of school. And so please don't let us hear that you're, you know, having parties at home and, you know, having kids together unmasked. Please don't let us hear about, you know, activities that put your kids, your family, and ultimately our teachers as well and other kids at risk, because COVID doesn't care. COVID is, you know, apolitical, doesn't make determinations on, you know, where we're from, what we have. It doesn't matter. It just travels without regard to that. And we have to think about acting as if everyone we come into contact with has COVID. Like, just keep that in our mind, because that's the way that we're going to protect ourselves from getting it from each other. This is the image that I have been sharing with everyone for the last several weeks, updating by the week in terms of our operational status. And you can see we went from more greens and yellows to a lot of red in the last couple of weeks. And it's quite staggering when you can see from, you know, even the school-wide data here, which we started looking at several weeks ago. We plugged in all the zip codes from where all of our families are from. And the week of October 28th, we were at 4.88%. And this week we're at 9.85%. And then you can see here Chicago and Cook County. This is the 7-day average positivity rates. Thankfully, Evanston is smaller, but it's been growing, you know, week over week over week over week. And then, you know, the proportion of new cases to 100,000 are just extraordinary. And then here the hospitalizations piece. I started to get more concerned as you see, you know, ICU availability being reduced. When you get down to 20%, that is a really difficult position for Lakshmi and all of the folks there at Northshore to be facing, but obviously for all of us if we end up needing to have medical care if it's not available. The other thing is this rise in youth cases. We went for weeks and weeks and weeks and weeks with minimal, and then all of a sudden jumped to substantial. And, you know, I think there's a couple of reasons for that. I love sports. I was an athlete. I was a musician. You know, I did all of those things as a kid. I was a thespian. I did all of that stuff. But if we're participating in those things without masking and taking, you know, those precautions, there's going to be spread. And if we let our guard down and we have parties and sleepovers and all of that, there's going to be spread. So that's what we're seeing happen here. And, you know, as you know, we had our first case of COVID in with one of our staff members this week. Hopefully, we don't see community spread as part of this. So far, so good. The reports that are coming back from tests so far have been negative, and I hope that continues. But in order to preserve on-campus instruction as long as possible, we need to keep abiding by that community pledge. I did want to address, and then we'll open it up for questions. I did want to address the change that we made this last week, where we added a new status to our health and safety plan of Orange B. For those of you who have looked at the plan in detail, you would notice that that was not a status that existed until last week. And, you know, as I shared with everybody, just as the state has changed from more of a hammer approach to a scalpel to try to address COVID, we felt that we could do the same thing because by, you know, all of those stats that you just saw, all of the red, if we just looked at those metrics, we'd have our entire school in remote learning right now. And I certainly know that parents aren't interested in that. And our faculty really want that. They know that on-campus learning is the best for kids, but they're also worried for themselves because they have all of a sudden become frontline workers. And teaching in a pandemic, and I'll move my picture here. I don't know if you're seeing what I'm seeing, but yeah, a window into teaching during a pandemic is rough. You can see here, Mrs. Hecht, pre-COVID and post-COVID, you know, keeping your distance, trying to, you know, do excellent teaching. Our teachers love what they do, and it's really, really hard. And some of them, this is me, if you didn't recognize me behind the shield and the mask, because I didn't have another picture to throw in there, so I had this one. But we do have and some of our crossover teachers, especially, they're having, because they're in different cohorts, they're having to wear masks, they're having to wear shields. This is a really tough way to teach. And imagine that you're teaching 8-hour days, you know, you've got all of these kids in your classroom, and we've reduced the class sizes, as you know. But all day long, you're having to not just teach, but constantly reminding about the social distancing and making sure that the kids are, you know, doing the right thing, the hand washing, the masking, and you're doing this with the mask on yourself. You're not hydrating as much as you would because you've got the mask on. It is exhausting. And this is not what our teachers signed up for, but they are doing it. They are working their tails off. They're working, in some cases, 12, 14-hour days plus weekends to support your kids. And they love your kids and want to support them, but it's really, really hard. And so I'm sharing this with you to give you some insight into how we need to lean into our partnership. And again, asking you all to continue to do the right thing at home when your kids aren't at school. Our goal is to find ways to support on-campus instruction as much as possible. There may be a case where the government comes in and just says, well, we have to close schools for a while and all of us are going to go back to being at home. And, you know, they got close to that today with the suggestions for people to work from home as much as possible. But they specifically excluded schools. And they did that because they believe that it's really important for kids to be in schools if we can do it safely. And yesterday, I was talking with a fellow head of school of a big school in Chicago who shared with me his belief that the health departments are looking at us and how we are able to operate safely as a model for how they can open up the public schools. So if we can show them that we can do this well and keep our communities safe and not have outbreaks of COVID in schools, then maybe other kids who are less fortunate to have a place like Roycemore will have a better shot also at being back in school. So that's enough of my lecturing. This is a school after all. I have to have my shot at that. But I do want to open it up for some Q&A, and I see a couple of notes in the chat and some Q&A. So let me throw out a couple of the questions. The first one, can you speak specifically to children getting this virus, as well as the children's ability to transmit the virus between themselves and to adults, number one? And number two, since we found out that a middle school faculty member at Roycemore tested positive to COVID, we also found out that the person's exposure to students was well below the Evanston's public health suggestion. Was it really necessary to have all the middle school go fully remote? So I'll take the second one, but Lakshmi, do you want to address the first one there?
Yeah, so I think the question is, can kids transmit this virus? Was that really the question? I'm sorry, could you say it again?
Yeah, if children getting this virus, about children getting the virus, as well, the children's ability to transmit the virus between themselves and to adults.
Yeah, so children can definitely transmit the virus. And, you know, I think what's important, and many of you may know this, but the SARS-CoV-2 virus attaches onto the ACE2 receptor, and the ACE2 receptor isn't really fully developed in kids. That's why they're not really getting very sick. So when you think about, you know, who's getting sick from COVID, it's not kids. I mean, thank goodness for that in general. And so, you know, but that doesn't mean they can't give it to you. And it's difficult. And that's why when you have kids that are, and many kids will have a runny nose, like all the symptoms that you can have with COVID are very common in kids as well. But yes, kids can get it, and kids can absolutely transmit it. But if they do get it, in general, it's very mild. So it's less about their illness, and which is important, but it's more about the transmission to others in the household.
Okay, terrific. And then the second part of that question had to do with the move to the middle school going fully remote. So because of the way that we have teachers that teach multiple grades, and there was no way to fully guarantee that there wasn't close contact and exposure. We felt that the safest way to approach this was for the whole middle school to go remote. I will say the technicality is that the Evanston Department of Public Health did not define by their definition of close contact of, and CDC's definition of 6 feet or less, 15 minutes or more as close contact. So there's only actually a couple of people that they are, you know, asking to quarantine at this point that I know of. That being said, the safest thing to do is to quarantine. And I know we've asked all families to have their students tested before coming back to school, because that way we can ensure that everyone's safe, right? And that there hasn't been a cluster spread here. And Lakshmi, you can speak to this. A lot of COVID is asymptomatic. And I think that's, you know, part of the challenge is that, you know, there could have been some spread going on. You know, if this was a community spread event, there could have been some spread among students that wouldn't have resulted in symptoms. And so in order to just make sure, especially since this is our first case and it's a good test of our system, we wanted to take these higher precautions for our approach, higher than what the EDPH suggested. Okay, so next question is if there's going to be any action taken against families who participate in the high-risk activities outside of school. So if we learn that there are activities taking place outside of school that really kind of violate the return to school agreement, we will address that with the family, and we will ask for their child to go into a remote learning for a period of time until we know that that they are safe to return. Okay, so like, if your family makes choices that would put other people at risk, we will address that with you. Let's see, there's another question. If other cases come to light as a result of tests done this week, will the Roycemore community be informed about the number of positive results? It would be useful to know to what extent a case might result in community spread. Yes, we would. It is my commitment to the community to be transparent. You have my commitment to you for that. Will we return to school is the question. Yes, that's the goal, absolutely. What can parents do in addition to adhering to guidelines to support the Roycemore staff? That's such a nice question. We appreciate everything they do. Thank you. There are so many things that you can do. The first thing I would say is be patient and be kind, and just recognize that teachers love your kids. They love what they do, and it's really, really hard right now. If they received thank you notes from you, from your kids, that would go a long way. Grubhub gift certificates go a long way. Just any expressions of kindness are really, really well received. And I know the Roycemore Family Association is gathering some ideas that many of you submitted ideas in the survey that we sent out, and I thank you for that. There's honestly not enough that we can do to thank our faculty who are just going above and beyond. And many of them are teaching both kids in their classroom and kids who are off-campus learners. And that is a huge task in and of itself. So thank you for that question. Another one is, what is the likelihood that the upper school will be able to go back to in-person classes before winter break, even for 2 days per week? We are looking into that right now, and we'll report back on that shortly. Let's see, what are your thoughts on the saliva testing being done at New Trier and other schools? Lakshmi?
Yeah, so it's interesting that we're the only country in the world that's doing saliva testing. And you might say, well, why is that? Well, that's because the supply chains for swabs isn't where it should be. Like, we're still struggling to get enough supplies to do the nasopharyngeal or oropharyngeal tests. So I would say that the saliva test at New Trier was developed, I think, at the University of Wisconsin, if I'm correct. And it was validated there, and it was validated at the University of Illinois. So what we, if you have a positive saliva test, then you have to go and get a PCR test to prove that it was a true positive. So again, it's a good test for surveillance because, again, they're testing it in a large population. You just have to spit into a tube. You're not sticking the thing all the way back in your nose. And so, for large scale efforts, it is actually excellent, but the validation isn't widespread. So everyone's kind of developed their own, like Yale has a saliva test, the U of I has a saliva test. But if you would say, are they the same saliva test? Not sure, but they're validated within those environments. But that gets back to my first point of tests being used for surveillance, right? Because at New Trier or at Yale or at wherever, what they're doing is they're saying everybody's going to have to come and spit into the thing 3 days a week. And if you get a positive, we're going to sequester you, go see if it's a true positive. And if it is, you're going to have to, be quarantined. And so I think eventually we're going to see much broader surveillance testing in exactly that way, because it's not nearly as noxious and it's a self-collected specimen. The challenge we have right now is that none of those platforms are really available in healthcare settings, and healthcare settings are under the strain of trying to manage the sick people and the folks who are ill with COVID. So the surveillance piece of healthcare is typically done through public health, and they don't have widespread access to the saliva test right now. The test they are going to have access to is the Binax Now antigen test. And so that's going to get distributed, I think, primarily actually to some schools and into some of the subacute or long-term care facilities. Because again, that's an antigen test. It has a lower sensitivity, but it can be used more for these surveillance kinds of purposes.
Terrific, thank you.
Yeah.
Okay, this is from one of our students. How will we know that it is safe to go back into in-person/hybrid instruction? How will the school be sure that an apparent reduction in positivity rate is not just an erroneous data point? So I'm not entirely sure on the thinking of that one, but I'll address it and then let you comment additionally, Lakshmi. So right now, all of the upper school and all of the middle school is off campus. And after we learned of the COVID positive result in one of our staff members, we had our cleaning company do 2 different nights of deep cleaning in all of the middle school and upper school areas. So from the standpoint of the building itself, the building is clean. From the standpoint of the students, as you know, we've asked all middle school students and faculty to have COVID tests. Now, those tests are just a moment in time. So you could get that test 1 hour, walk down the street unmasked, and run into somebody who has COVID and get COVID. So it's only telling you that moment. So that's why it's really important to continue all of the other mitigation measures, both off campus and then what we do to screen everybody who comes onto the building before they can come into the building with the wellness screener and the temperature checks, the hand washing, the mask wearing, the social distancing. Would you like to add anything more to that, Lakshmi?
The only thing I would say is, we can never make a decision off of a single data point. I mean, even when we look at our data day to day, we'll see variations and fluctuations. And so it's important to kind of see what the trend is over time. And if you look back at that grid, what we're looking at is when something really shifts and that it stays shifted. And I think that's, again, gives you a clue that it isn't just one point in time or there's a special cause for that variation, but rather it is a true shift in the population.
Okay, thank you.
Mm-hmm.
So our next question is explain the reasoning behind middle school hybrid plan, where all middle schoolers are in school 2 days and remote 3 days. That this does not seem to lessen the number of students sharing the space at one time. So our Orange B plan does split the middle school into 2 cohorts, into 5, 6, and 7, 8. In the case that we have right now, we have potential exposure to everyone because it's with the faculty member. But let's say if there was a COVID positivity in grade 7, so grade 7 and 8, who are a cohort together, they've got the exposure, whereas 5, 6 doesn't. So 7, 8 could be considered close contact where 5, 6 doesn't. They have, by just having them in the building, they're spreading out more in the building. Our hope is to find opportunities other days of the week where upper school might be able to be on campus sometime, and we're still looking into that. So that's part of that, and then just providing separation in the days between middle school and anybody else being in the building, and having time between the last time the middle school was on campus and then when they come back. Question, when will school return? For middle school, the focus for that would be a week from Monday. So that week of Thanksgiving week gives us a full 14 days from the time kids were last on campus. And then if someone has had COVID, can or should they still get the vaccine? Lakshmi?
Give me just 1 second. I just have to take one call. 1 second.
Oh, okay. I'm going to look in the chat. There's some additional questions here in the chat.
Great. Actually, I'm free now.
Okay.
So actually, I would say you would still be eligible for the vaccine because we're not actually sure if the antibodies created through a COVID infection, how long they last. And, you know, it's exceedingly rare, but there are a couple cases reported in the literature of individuals getting COVID 2 times. So there was a person who got COVID in Hong Kong, went to Europe, and then as he was coming back in through the airport, they just did their routine COVID test. It was positive because he lives in a country where they have, you know, kind of centralized healthcare. They compared the genetics of his first test to the second one, and it was different. So I would say that right now having a COVID infection doesn't preclude you from getting the vaccine.
Okay, terrific.
Yeah.
And then there's a question here for you, Lakshmi, that you mentioned that positive COVID tests can last months. What happens if a student gets COVID and can't get a negative test, even though they are no longer contagious?
Yeah, so actually the CDC has dropped their recommendation of repeat testing, and you're considered COVID recovered based on a clinical definition. So 10 days since the onset of symptoms, and that you're fever-free without fever-reducing medications for 24 hours. So if you fall into that definition, you're recovered from COVID.
Okay, terrific. I do want to just emphasize, we talked about it a little bit, but I want to really emphasize for the middle school students that it really is important that the kids quarantine during this 14-day period, right? To not expose, because you know there is sometimes a false negative, and you know if they had exposure and had a false negative on a test, the best way to protect is that you have that 14-day period, in which case if you don't see symptoms arise, then you're pretty clear from COVID. Am I stating that correctly, Lakshmi?
Yes.
Okay.
Mm-hmm. Yep.
Let's see. There's another question. Lakshmi mentioned that positive COVID tests can last months. Okay, we talked about that one. I want to see if there's anything else. If other cases come to light as a result of tests done this week, will the Roycemore community be informed about the number? Yeah, we talked about that one. Okay, I'm thinking we have answered. All right, we've got another one that showed up in Q&A. Any information about when the vaccine would be available and or possible to be administered to people with compromised immune systems?
So, so I think we're going to have to get through this first phase where many, many more people will receive the vaccine. Because remember, these trials have, they don't have millions of people. So what we've learned from vaccine administration from other vaccines that did well in the trial, and then we learned about some issues when they were broadly administered, we're going to need to wait for that as well. Obviously, we're making a risk-benefit calculation for healthcare workers and folks in long-term care, saying, "Wow, the benefit for you of getting the vaccine overrides any potential risk we haven't yet uncovered in the vaccine." So I would say that as we learn more, we'll be able to know what are the next populations that we would want to offer the vaccine to. And just so you're aware, within healthcare, many people who work in healthcare are immunocompromised or have chronic disease. So vaccinating that population is going to give us an enormous amount of information.
Terrific. All right, another question came up in the Q&A. Once a vaccine is widely available, will students and faculty be required to get it absent any medical excuse not to? So that's a great question. I don't believe that Roycemore is able to make that a requirement. It would have to come from the state, I believe, because of potential religious exemptions. But I will tell you this, we will highly, highly encourage it if we are not able to require it. It would be my hope that we could require it. But I know that there are certain things that we are not able to require as a school. So I have to go by, what I'm allowed to do legally as a school leader. All right, another question. To be clear, your recommendation that the middle school kids quarantine now is based on an abundance of caution, correct? Correct, question mark. You have said that they have not met the definition of close contact, so they would not officially be required to quarantine unless you contact a specific child who did have close contact with the faculty member. That's what EDPH said to me. So Elizabeth Lassiter is my contact at the Evanston Department of Public Health. She's been really terrific, gave me her direct line. If I need to know what she said to me, exactly that. What I am saying to middle school families is that we're asking you, we can't require it because the state isn't requiring it, but we are asking you to quarantine your kids at home for 14 days because that's what's going to keep them and all of us the safest we can be. Another question, middle school is already split into 2 core cohorts, but are you looking into doing a hybrid with the 2 different groups, 5th, 6th on Monday and Tuesday, 7, 8 on Wednesday and Thursday? That's not something we're looking at right now. We are, as I said before, we are looking at how we might be able to provide some on-campus opportunities for high school kids. And our hope is the positivity rates will go down a bit so we could just have them all back on campus. So please sign the safety pledge, spread the word, and get on that social media, share what Lakshmi shared with you, and let people know this works. It really, really works. And if we can convince everybody to get on board with this plan, we can get back to our lives. It's really simple. It's really, really simple. It's a little sacrifice for a lot of gain. And this is the huge gift that we can give ourselves and to our families and to our friends by really being amazing advocates for the mask wearing, the social distancing, the hand hygiene, and so on. Okay, share the QR code again. I will do that. Let me bring that up. Let's see, hang on. I'm gonna get there first.
And Adrianne, you can just send that slide out to everybody.
Oh yeah, that makes a lot of sense. But let me bring it up on screen. There you go. I'm gonna make it big. northshore.org/COVID safety. All right. Lakshmi, I want to thank you so much for your time this evening for our community. You all may not know, she has no direct connection to Roycemore. She's just being a wonderful supporter of us and our focus on education, and an amazing leader in our community, keeping our community safe and healthy. And thank you again for your support.
You're welcome. I mean, I'm a mom. I have 2 kids. They are older. Our son graduated from high school. Our daughter is applying to medical school. So I know how important it is for, as a parent, for kids to go to school. And so I care about that. So,
Perfect.
thank you.
All right. Thank you, everybody, for tuning in tonight. Take care of each other. Take care of yourselves. And I hope to see you soon. Bye-bye.